Welcome to your internal medicine clerkship. Now this clerkship comes with 3 guarantees. You're going to be a good reporter. You're going to interview and do physical exams on real patients, review the data, and present all that information orally and in writing so that you sound like a real physician. It's going to help you on your other clerkships and down the road whatever specialty you go into. We're going to push you to be an interpreter, come up with assessments, differential diagnoses, and if you're good and you really demonstrate ownership, we'll let you manage and educate our patients with us. The next thing is licensing exams. You should be more confident when you take this exam because we give you context for the science and we deliberately review it during the 15 weeks. And not to be underestimated, you're going to be happy. Tired a lot of days, but happy because you've directly contributed to the care of patients, you've learned something, and you've improved with feedback. The clerkship is 10 weeks long, split into 5 weeks of ambulatory or clinic and 5 weeks of ward or inpatient. Now don't forget you do have this 5-week psychiatry block. The sequence of all these rotations may vary, but not to worry. The quality teaching and experience is going to be the same. During the week there's a lot of protected educational time. Twice a week, 2 hours each, you have a preceptor session where you and a couple other students with a specially selected faculty get together to practice your presentations, evaluate patients at the bedside, review cases, and educate each other. Once a week, you'll also have your interactive group sessions, or IGS, which is a special didactic series just for medical students, led by a local subject matter expert. There are 15 core topics. For the 5 you miss while you're on psychiatry, we'll give you an online simple case to do. Another big thing is the write-up. 3 out of 5 weeks you have one due, and it's always due the end of the week on Sunday. A write-up is one of your patient's history and physicals with a 3 to 4 page assessment and plan. Don't worry, if you're a little rusty, we even give you a template reminding you how to write one. The last page of that template is the grading form that your preceptor uses. Now for each write-up, don't forget to post a basic science fact about that case onto our Back to Science blog. This is going to be a great resource, a great step 1 study tool for you and your peers, and believe me, it's no BS. Now if you have less than 3 or more than 5 references for your write-up, one of them being Harrison's textbook, or if you spend less than 3 or a lot more than 5 hours on these things, you might be doing it wrong. Check with your site director. Now in week 4, rather than a standard patient write-up, you're going to submit an art reflection. And basically you're going to discuss either a good or a bad example of professionalism you've seen in the hospital, and you're going to use one of a series of paintings we provide for context. Also, for one of the geriatric patients that you cared for in the hospital or in the clinic, you're going to arrange to see them in their home and then write up an assessment of that visit to give to your preceptor during week 9. Remember to upload every assignment you do into Sakai and email it to your preceptor so you can get feedback. Now what does ambulatory rotation look like? Well, first you're going to be working one-on-one with a physician, and everyone's schedule is a little different, but as an example, let's say it's going to be the same cardiologist every Monday morning, endocrinology clinic Wednesday afternoon, and then gastroenterology or GI Thursday mornings. Each of 3 half-days per week you're going to be working with a different general internist, and that gives you 2 half-days that are unscheduled to review patient records, catch up on your notes, documentation, or other assignments. For each half-day of clinic, we want you to see about 2 patients, which means you'll have about 2 hours of homework for each half-day at clinic because you have to review patient charts in advance, write your clinic encounter note, follow up your patients after clinic, and then read a review article or other brief assignment from each physician. On the inpatient wards, you're going to work on a team with 1 or more other students, interns, a resident who supervises you, and an attending physician who's responsible for the overall care of the patients. You'll get in early to round on your patients 6 days a week, attend a case conference, and then use the rest of the time to participate in procedures, interact with consultants, and do your chart documentation. You should have 1 to 3 patients at any one time, and you'll get new patients whenever your team is on call, once or twice per week. Now 2/3 of your grade is based on your clinical performance, but back at USU during week 16 assessment week, you will have 3 examinations, an MBME or shelf multiple choice question test, a video-based multi-step exam, and then an OSCE that includes both medicine and psychiatry cases. This is a lot of information. We'll go over it again at orientation. Don't worry about it. And don't lose track of the big picture. You've worked hard over the past 18 months and you've earned the right to be here. but you can't be a bystander on the internal medicine clerkship. You're expected to give your opinions. You're going to be directly caring for patients, seeing a lot, doing a lot, all under the supervision of physicians who are carefully selected and keenly interested in you doing well. We'll see you soon.